really pleased to be with you all today. Linda approached me, as she said in the introduction, of just really a few days ago, and we had this discussion around providing some science and current knowledge on what is out there in terms of surface testing and whether in fact it is appropriate to do surface testing in a food facility for the SARS-CoV-2 virus. So without further ado, there is a lot of information that we do have on this virus, but there's also a lot that we don't know about it. So I am providing to you today information according to the current state of knowledge, because every day, literally, we are finding out new things about this virus. So it's inevitable that over time, some of the information may change. And this is precisely what happened at the end of March, when I presented a webinar for SAFOST on whether this virus was in fact a food safety risk. And the last few slides on that presentation pointed towards the issues around masks. And whilst a lot of science has been conducted on masks, there is, of course, a lot of conflicting opinion on whether a mask is effective or not. So that also has changed since then. So please do take note of the copyright that is affecting these slides that I am presenting to you today. So the purpose of today's presentation, as I said, is to really provide you with the latest science and knowledge on SARS-CoV-2, which is then specifically related in this case to surfaces, in the hope that I can assist businesses and other people that are on the line to make informed decisions on testing for this particular virus. You will also note, and some of you who have known me for a while, I have started to work on this entire systems thinking approach, because this is actually the correct approach when one looks at any food safety management issue or even personal protection issues in terms of people's health. So the webinar I mentioned earlier on, you can actually click on the safos.org.za link, and it will take you to that webinar if you wish to download and listen to it. So with some background, I'm sure most of you know this, that the previous coronavirus outbreaks have happened. There have been two. The first one was in 2003, and it occurred in China as well. And it was called the severe acute respiratory syndrome. And that's where SARS, the abbreviation, comes from. That particular outbreak caused about 10% mortality rate. There were quite a number of cases, around 8,000, but yes, it caused about almost 800 deaths. And then in 2012, a second type of coronavirus outbreak occurred, and this one was called Middle East Respiratory Syndrome. And that occurred mainly in the Arabian countries where camels are prevalent. And that occurred in 2012. So this was very much a camel-related virus that jumped from animals to humans. And there were few cases. There were only around 2,500 cases, but it was an extremely deadly virus in that it caused a 34% mortality rate. This current virus, SARS-CoV-2, is the new name of the virus, and a lot of people just call it coronavirus. And it appears as if it has a mortality rate of around 2 to 3%, which is much lower than these two. But the difference is that it's a highly infectious virus. It has caused a pandemic, as you know, and it emerged in 2019. COVID-19 is the disease that it causes. And what I want to mention here, and I'll come back to this point later because it's really an important point in terms of our discussion today, is that this virus has a lipid envelope, which is a fatty layer on the outside of the virus. And this lipid envelope actually makes the virus really susceptible to a variety of disinfectants. And also what I'd like to also kind of put my stake in the ground right here at the beginning is to say that this virus is primarily a respiratory illness. And that is also important because it's going to relate to what I'm going to show you in a few slides' time. So the main symptoms are fever, cough, and shortness of breath. However, there are other symptoms that have emerged which are regarded also as pretty important. Chills, muscle pains and aches, sore throat in some cases, and then a new loss of taste or smell. In a small percentage of cases, people start to not taste or smell their food any longer or other smells in the environment any longer. And this could be an indication or a symptom of SARS-CoV-2. There is also fatigue. Some people complain of headaches. And then there's diarrhea, nausea, vomiting, and so on. And then when it becomes really quite severe, then you have the more severe symptoms such as those that cause pneumonia, which cause the airways to block and lack of oxygen. And then, of course, the whole cytokine storm that people talk about starts to occur. The current modes of transmission are person to person via touching, shaking hands, hugging, kissing, etc., and droplets from coughing or sneezing, particularly within 2 meters. And that is why the social distancing issue is absolutely vital in this particular pandemic. The third way of potential transmission is contaminated surfaces. And I have put it in brackets and I have not highlighted it because there is a lot of debate around this. So let's have a look and see what happened a little while ago in terms of food safety. On the 30th of January this year was the first time I started communicating with the food industry about the coronavirus. My belief at the time was that the virus would come to South Africa. It was just a question of time. We would not escape it. And the question that I then asked in that document I sent to industry was, can the 2019 novel coronavirus, which was the old name that was given the virus, be transmitted via food? And the simple answer at the time that I entered into this document is that we do not have evidence that the 2019 novel coronavirus is transmitted via food. And in fact, this remains the status. There is no evidence currently that COVID-19 virus is transmitted to humans via food, or indeed food packaging, or indeed food ingredients even. So it is not regarded as a foodborne virus, like, for example, norovirus, hepatitis A, and there are some others that are regarded as foodborne. So those, when it comes to foodborne viruses, we kind of know what we're dealing with. But in terms of this coronavirus, and being a respiratory illness mainly, means that it is not transmitted to humans via food or food packaging that we know of. This conclusion has been arrived by a number of food safety agencies and authorities across the world. And you can look at the Food and Drug Administration of the US, the United States Department of Agriculture, the Center for Diseases Control and Prevention in the US, the European Food Safety Authority, the Food Standards Agency of the UK, Food Standards Australia, New Zealand, Food Safety Authority of Ireland. You can go to the Canadian website and so on, and you will find similar conclusions. There have been questions asked around the fecal-oral route of contamination. The reason for that is that in some cases, the virus has been picked up in stool samples or indeed anal swabs that have been taken. But in spite of that, in some cases, there was described cultivation of the virus from such samples, And in other cases, only the RNA of the virus, the nucleic acid of the virus, was detected. And so it becomes also an issue of how do we interpret those kind of results. But to date, there have been no cases reported of fecal oral transmission of this particular virus. So the fact that we're finding a virus or a portion of the virus in a sample of some sort doesn't necessarily mean it's automatically a risk. And this hazard versus risk issue is something we grapple with all the time in the food industry, even when we are not even talking about the coronavirus pandemic. So it's really, really important to grasp the difference between a hazard and a risk. And this is also the conclusion that the World Health Organization came to on the 29th of March, and it's on their website. The virus is believed to be killed by cooking at 63 degrees Celsius for 4 minutes. This is now in food. And there's no reason to believe that it is this particularly heat-resistant virus at all. It acts in similar ways to other human coronaviruses and the SARS virus and the MERS virus. And this is also based on an expert consultation that was conducted by the French Agency for Food, Environmental and Occupational Health and Safety. So obviously this ANSES is the French translation. Regarding refrigeration and freezing, there is not a lot of data available on this particular virus. But if we look at previous coronaviruses, which is typically what scientists do, because we do look at existing scientific information that we can use to inform us when we don't have specific data. The veterinary coronavirus in this case survives refrigeration at 4 degrees Celsius for over 28 days. And this is work that was done by Rabineau et al. Already in 2005. And they found that exactly the same virus did not last very long at higher temperatures. So it looks as though the SARS coronavirus 2 may actually react in a similar manner. It will probably survive refrigeration, and it'll probably also survive freezing, as most viruses do. So the question then became, what about infected food handlers? And ANSES again did this risk assessment. It was a preliminary risk assessment, but again, if you look at the Food and Drug Administration of the United States, there is concurrence that it is acknowledged that food can become contaminated by infected food handlers, whether they are symptomatic or asymptomatic. But even so, there is no evidence that a person can actually become infected through eating contaminated food. Because when we eat, we swallow our food and it goes into our digestive tract. And there's currently no evidence to suggest that the virus can migrate from the digestive tract into other parts of the body and infect the lungs, for example. And the gastric juices, and we know that our gastric juices have a very low pH, quite acidic. There is a belief that the gastric juices will actually kill the virus because it is not resistant to very low pH. So in conclusion, in a food manufacturing and retail environment, the greatest risk is actually transmission from person to person, not transmission to food. And then, of course, in the food industry, we've got very good food safety management systems in place. Some of them can be rather basic, based simply on HACCP. Others can be more sophisticated, like your ISO 22000s, your FSSC 22000s, and other. But one thing they all have in common is they are all built upon a solid foundation of good hygiene practices. And so this is really the time to go back to those basics and to reinforce all of those good hygiene practices and to instill what I've termed recently a hygiene culture in the organization. And it's always good practice to prevent any contamination of food, whether it's bacterial or viral. And the food industry has been washing its hands with soap and water for 20 seconds, singing happy birthday twice, And this is something we've been teaching people for decades in industry. And we know that washing hands with soap and water as a very basic hygiene measure has been in existence in the history of the world for the past 100-odd years. So this is actually nothing new. What the COVID-19 pandemic has created is a higher awareness of the importance of washing hands with soap and water for the specified time. And also what the industry, the food industry, does when it comes to very high-risk foods. And by that I mean foods that are not going to be cooked or reheated properly before consumption, that after washing with hands with soap and water, it is always good practice to then sanitize them as well with a minimum of 60% alcohol hand sanitizer. So these are the basics that I am referring to that really do need to be reinforced, retrained, and made sure that it is actually implemented. So there was a really interesting experiment that was conducted by a number of authors that published this article, Aerosol and Surface Stability of SARS-CoV-2 as compared with SARS-CoV-1, which was the first SARS virus that emerged in 2003. And it was published in the New England Medical Journal, and there is the reference. And they found under controlled experimental conditions, where everything was well set up and controlled, that the virus could survive for up to 3 hours in aerosol. And this was, and it's worth noting that the 3 hours was the duration of the experiment, and it was conducted at 65% humidity and at 21 to 23 degrees Celsius. It could survive up to 4 hours on copper, up to 24 hours on cardboard, and up to 72 hours or 3 days on plastic and stainless steel. And the latter 3 experiments were conducted at 40% humidity and 21 to 23 degrees Celsius. And it's highly likely that these survival times will probably differ when the humidity changes and when the temperature of the environment changes. The World Health Organization came out with some really interesting statements about the presence of this virus on surfaces. And they said that the coronavirus can go airborne, staying suspended in air depending on factors such as heat and humidity, as I mentioned in the previous slide. But they've also limited that saying or approach to a medical healthcare facility. And they say furthermore that this is of importance to medical staff where there are aerosol generating procedures that occur, such as in a medical care facility. There is therefore a possibility to aerosolize these particles, which means they can stay in the air a little bit longer. And of course, they can land on surfaces in that particular environment. And so work has been done to show that linen, bed linen, curtains, and things like that in a medical healthcare facility can actually harbor the virus simply because there is a person who is being looked after who is shedding huge numbers of viruses because they have been identified as positive COVID-19 patients. And furthermore, based on that saying from the World Health Organization, they then say, we recommend that medical staff wear N95 masks because they filter out about 95% of all liquid or airborne particles. So very important in a healthcare setting. And then World Health Organization published on the 18th of February of this year a document entitled Surface Sampling of Coronavirus Disease, a practical how-to protocol for healthcare, very important, for healthcare and public health professionals. And then if you go further into the document and you actually read it in detail, they do say that this protocol has been designed to determine viable virus presence and persistence on fomites. Now, fomites are inanimate surfaces, for example, in various locations where a patient infected with COVID-19 is currently receiving care or being isolated, and to understand how this may relate to COVID-19 transmission events in these settings. Furthermore, the Centers for Disease Control and Prevention in the United States published this on their website on the 10th of April. This is work that was done by a group of people that then stated that they tested air and surface samples in general wards and ICUs of hospitals. And this is typically in a healthcare setting where one would expect to find a high viral load. And their conclusion was that contamination was greater in intensive care units than general wards. Makes sense. The virus was widely distributed on floors, computer mice, trash cans, sickbed, handrails, and was detected in the air approximately 4 meters from patients. And this supports the previous work that the World Health Organization that I've shown you in the previous slides have also concluded. And then by a publication by Ong et al. In 2020 called Air Surface Environmental and Personal Protective Equipment Contamination by SARS-CoV-2 from a symptomatic patient. Again, it was in a healthcare setting. They then cleaned and disinfected very heavily contaminated patient areas with specific disinfectants. And after cleaning and disinfecting, there was no virus detected, which shows here very clearly that even in a heavily contaminated environment, if cleaning and disinfection is done correctly, the chances that virus will remain behind is actually very, very limited. Coming to touching surfaces or objects outside healthcare settings, the CDC once again makes a statement. They say it may be possible that a person can get COVID-19 by touching a surface or object that has the virus on it, and then touching their own mouth, nose, or possibly their eyes. And then, most importantly, they say this is not thought to be the main way the virus spreads. We can even go and look at what New Zealand says. And this is a group in New Zealand that does research on food safety science. They say the primary transmission route for human infection with SARS-CoV-2 is via respiratory droplets, correctly so. They go on to say something similar to what the CDC said in my previous slide. It may be possible that a person can get COVID-19 by touching a surface or object that has the virus on it, and then touching their own mouth, nose, or possibly their eyes. And most importantly, but this is not thought to be the main way the virus spreads. And then this report by McKinsey this month, a very, very intriguing and interesting report, has shown that in fact, 85% of transmission occurs via symptomatic people and pre-symptomatic people, and 5% is believed to be asymptomatic. They do concur that these numbers may change because the more testing that is currently being done in various countries, the more we are finding asymptomatic people who might never show any symptoms and are able to transmit the virus. But most importantly, in this report, they say that only 10% of transmission of the virus occurs in an environment, and the environment includes surfaces. So this is really a very small percentage showing how the virus can be transmitted via surfaces. So the vast majority falls within these three. Whether there are 40 or more or less doesn't matter. The point is that 90% is covered by symptomatic, pre-symptomatic, asymptomatic people, direct person-to-person transmission, and not via fomites. So to recap at this point, there is no evidence that the SARS-CoV-2 is in fact a food safety risk. Food safety management systems in place are based on good hygiene practices, including washing and sanitizing hands, not coughing, sneezing, spitting over food. It's all included in those documents and those various standards. This is nothing new. And of course, there are many other personal practices that one has to observe in a food environment, which will certainly go a long way to help to prevent that food becomes contaminated. In addition, there are other COVID-19 related measures that are either legislated in South Africa or not, and they are important to observe, like wearing masks, coughing and sneezing practices, the elbow issue, coughing into a tissue and then throwing the tissue away immediately, etc. Distancing of a minimum of 1.5 meters where possible according to local legislation. And of course, it's not always possible to have that 1.5 meter, but certainly you would have some form of separation. And then most importantly, there is a large number of evidence, assessments, expert consultations, published literature and reports, and I've shown you a few, to support the notion that contaminated surfaces in a food setting are unlikely to be the primary source of transmission of this virus, when in fact 10% has been shown to be involved in transmission in healthcare settings. So it is likely that this percentage might even be lower in food settings like food manufacturing and food retail. And now to cleaning and disinfection, which is a very important part of a systems approach when you are thinking about what do I test for and when and how should I test. The coronavirus, as I mentioned earlier, has this lipid envelope, and you can clearly see it in this diagram. Here you have the spike proteins that are involved in attaching themselves to the ACE2 receptors in lung cells, for example. And new evidence is shown that there are certain enzymes that are needed to help the virus to actually get into the cell, infect the cell, and then release its RNA into the cell. But outside the human body, this lipid layer, if that can be disrupted, then basically it exposes the rest of the virus and it's then easily killed. And this is a blessing in disguise because there are many viruses, some foodborne, that do not have this lipid envelope. And it makes it really difficult then to actually kill them. So this is, as I said, rather helpful because it makes the virus very susceptible to majority of chemical disinfectants that we are currently using already in the food industry. Therefore, it is relatively easily killed. And I think that's a key point to make. Furthermore, since the beginning of this COVID-19 pandemic, there have been a lot of advice. There's been a lot of advice to industry to say, well, you kind of need to just do things a little bit more intentionally and intently. For example, you would probably by now have altered your cleaning and disinfection protocol. You would probably be doing a lot of cleaning and disinfecting of food contact surfaces much more frequently than before. You would probably be cleaning and disinfecting common touch points. And if you aren't, then you should be more frequently. And these are things like door handles, countertops, step balustrades. Don't forget canteens, refrigerator doors in canteens, etc., locker rooms, computer keyboards, registers in retail, and so on. And there are many, many more. And then you are probably already doing a deep cleaning and disinfection as a routine, you might be doing it every 5 days, you might be doing it every 7 days, on weekends, whatever the case may be, as an added precautionary measure to make sure that you are actually getting rid of the virus if it's present on the surfaces in your settings. Also importantly is to choose your disinfectants very wisely. They must be effective against SARS coronavirus 2. The EPA has put out a very good list. They call it List N. And the reason why it's called List N is just simply saying that all the products on this list meet the EPA's criteria for use against SARS-CoV-2. And you can go to their website over here and you will find a lot of information about different kinds of active ingredients in various disinfectants that would be working quite effectively against this virus. There are, of course, alternatives as well, but what is really important is that discuss these with your chemical providers and make sure that you are comfortable that whatever alternative is offered to you is in fact supported with documentation that shows you that these alternatives are in fact valid and validated, so that you are comfortable that this particular disinfectant that you've chosen is able to clean and disinfect your surfaces adequately, specifically related to SARS-CoV-2. So with all this background, the question you are probably asking is, okay, but should I test for SARS-CoV-2 on surfaces? Well, I want to take a step back here. And those of you who know me and have asked me questions around microbiological testing in general, I always ask the question, why are you testing for X, Y, or Z? Have you asked yourself that question? And of what significance is that test going to be to you? Of what value is it going to be to you? Is it going to tell you something that you can act upon? Or is it something that is just there, it's available, and you think you should be doing it? So all microbiological tests are performed to reach a decision, usually, or to make a judgment of some sort. However, if the purpose for collecting a sample and having it tested cannot be defined clearly in your own mind, then you should probably not be conducting that test, because it's probably going to be a waste of money if it's not going to be beneficial to you in some or other way. We also must understand that all microbiological testing has its limits, and understanding those limitations is key. And also interpreting those results is really very important. And this leads to the fact that you should have a rationale for taking samples and having them tested. And that rationale should actually have been developed beforehand. And then lastly, you must do a cost-benefit analysis, taking all these considerations into your assessment. Because if you are deciding that you need to do a test, or maybe I should do a test, have a look at what that test is going to tell you and of what value it's going to be, and then do a cost-benefit analysis to help you to determine whether in fact it is useful. So in summary, taking everything we've said into consideration and looking at it from a systems approach, there is no evidence that the SARS-CoV-2 is a food safety risk, keeping in mind the early point that I made around hazard versus risk. The greatest risk remains person-to-person transmission. And we know that having tested this in healthcare environments, appropriate disinfection is key. And after that, there is no virus present. First, surfaces, particularly environmental issues, particularly focusing on surfaces, accounts for approximately 10% of transmissions in healthcare facilities, aerosols that will probably land on surfaces at some or other point. So in the food environment, it is likely that this may be less, considering all the other precautions that food manufacturers in particular are already taking, hence the systems approach that I have mentioned. So food safety management systems, in summary, including your good hygiene practices, already there is the washing and sanitizing of hands. There's no coughing, sneezing, spitting over food, and there are other good hygiene practices that are included in good hygiene in these various standards. There should be an effective cleaning and disinfection program in place that kills the virus, selecting the correct disinfectants. And then there should already be an increased frequency of cleaning and disinfection of food contact surfaces, and sometimes even deep cleaning on a routine basis, and increased frequency of cleaning and disinfection of commonly touched surfaces already mentioned. Over and above all of that, there are the additional COVID-19 related measures, like your masks that are now must be provided by law, coughing and sneezing practices that are hopefully being taught in the food facilities, a distancing of a minimum of 1.5 meters where possible according to law, or at least some form of separation where it's not possible, taking staggered breaks, and many, many more. And the purpose of this discussion was not to give you an exhaustive list, but to point you in the direction of what you are probably already doing, and taking all of that into consideration in a systems thinking approach. Based on all of this that I have mentioned, I hope sincerely that I have given you information that will help you to make a decision in terms of whether you should be testing for the SARS-CoV-2 on food surfaces. And just a reminder on the infographic I have put out on advice for food workers that is available on my website in English and Zulu, and it's coming out very soon in French for the Francophone countries in Africa. And with that, I want to thank you all for your attendance. And again, to Linda, Adele, Food Focus for inviting me to come and share these thoughts with you. Thank you very much.
Thank you so much, Lucia. It was a very, very informative presentation. I think just bringing all the research and bits and pieces that are out there together is just so helpful to allow us to see the big picture. A couple of questions, if you don't mind, just with regards to your presentation. One of the things that struck me while you were talking was the emphasis on preventative measures. And I almost feel that, you know, the HACCP approach that we use within food safety management systems is, as you know, my understanding is it intends for us to look at the preventive measures to ensure that processes will be under control rather than relying on detection. And I'm almost getting the same sense in terms of what you've been saying today, is that we should be placing a lot more focus on preventive measures to avoid person-to-person transmission.
Absolutely, Linda. Yes, thanks for that question. When it comes to food safety, as you well know, we do place a huge emphasis on preventive measures. And that is why going back to the good hygiene practices is so important, because over the past 15 years or more, in fact, I've been tracking food-borne disease outbreaks. And in about 96% of the cases, it's always about the good hygiene practices, which are there primarily as preventive measures. And then, of course, they built further into the HACCP-based systems that we see today. But yes, so I can only concur that even with the coronavirus, it is about prevention. It is about putting systems and practices and measures in place to prevent person-to-person transmission, because we can clearly see that that is actually where the major risk is.
I think, and also just with relation to, you know, the cleaning, the disinfection processes, from what I understand, and you have this virus which is relatively fragile as a result of this lipid membrane envelope, and so if I was doing surface swabs and I'm actually looking for far more robust pathogens, you know, for example, those that are able to provide a biofilm, or you know, that don't have the same structure, they're more robust, would it by implication, if I know that my disinfection program is working for that organism, by implication, it would then be working for something like the SARS-CoV-2?
Yes, absolutely. I have no doubt, although obviously there is no evidence yet, but if one looks at it logically and from a basis of understanding of how different microorganisms react to different disinfectants, some of them form spores, bacterial spores, and those spores can be really, really hardy and very resistant to disinfectants, far more so than the COVID-19 virus. So that kind of testing after cleaning and disinfection will most likely tell you that, in fact, if it's effective against those organisms, it will most likely be effective against COVID-19.
So if we had to look at what we're currently doing with regards to, you know, surface swabs, environmental programs, in monitoring programs, I mean, Listeria taught us that we should really be focusing on the environment and ensuring that the environment, you know, is under control when it comes to pathogens. We've been looking very much in those areas, but I do think that given what you've said with regards to re-looking at our cleaning programs, we now are looking at not only food contact surfaces, but we're also looking at people contact surfaces. You know, so I think perhaps whereas we weren't paying necessarily that much attention to cleaning or to even, you know, doing any surface swabbing of people contact surfaces, we now need to make sure we are doing both, because the person-to-person transmission is primary, the surface is less, but we do have a lot of surfaces, like you mentioned, canteens, you know, computer mouse, those kinds of things. We should now be paying more attention to those within our cleaning programs.
Absolutely. You mentioned earlier on something about detection, and I wanted to actually raise the point using the Listeria monocytogenes as an example. So yeah, thanks for bringing that up again. The issue with environmental testing based on foodborne disease organisms, those that can actually be transmitted via food, has been that focus, and detecting the organism is always tricky, because as I mentioned in a previous slide or two, that microbiological testing has got its limitations. And so it is about doing the most that you can do that is logical to do in a situation when you are looking for a specific pathogen. And if that includes environmental testing, by all means. And yes, food contact surfaces is important, and cleaning and disinfecting of those food contact surfaces, absolutely key. But yes, the COVID-19, because it is mainly a person-to-person transmission issue, wherever a person may touch a surface, there is a potential for carryover of virus to the surface. The next person comes, touches the surface, touches their mouths or noses or eyes without washing their hands beforehand, can actually transmit the virus. And that is why we are trying to, you know, impress on industry to implement those hygiene practices and to clean and disinfect commonly touched surfaces far more than was ever the case before. One of the interesting things is with these kind of surfaces, as an ICMSF group, whenever we meet, which is once a year physically, there's always someone with a cold or a flu, and we always keep our distance from each other. We actually don't hug that person and say hello.
Yeah.
You know, and we're very careful just to stay away. And we have hand sanitizers. And believe me, I'm not a germaphobe, not by any means. But, you know, if there is somebody we're sitting together for 10 days in a room, the chances are pretty good that we might actually pick up the virus from a surface, because that person is sneezing and coughing all the time, and we might carry it over to ourselves. The issue has never been a food-borne related one, but it's been a person-to-person transmission one, hence the use of hand sanitizers in those settings. So yes, absolutely key. So we know that lift buttons,
Yes.
and so on can become contaminated from touching.
Absolutely. And I think, you know, at the end of the day, these are, some people would say, yes, you are a germaphobe, but I think at the end, you know, this is the correct practice. We know how easy the influenza virus just moves from person to person, just because of exactly the same, you know, mode of transmission. So I think, as you said, that hygiene culture, maybe we become a little sloppy at that, you know, just as a human race, and you know, we just need to brush up on that. And again, the food industry should be at an advantage, but I do think our focus needs to change a little bit now, you know, and we do need to make sure that we are looking at these areas. Lucia, it has been fascinating. Thank you so much for the information. Thank you for the effort that you've gone to put this presentation together. I know that it was really at short notice, and I really appreciate everything that you have put into it and the way that you've packaged it for us, just to help us to understand the hazard, and then to help us to interpret the risk within the food environment, which is very much, you know, the area that we at Food Focus, you know, want to focus on and want to assist. We really thank you for your time today. Thank you for making yourself available for this presentation. I know that if I had to put everybody on microphone now, they would all be giving you a resounding round of applause for your presentation today. So thank you very much. We really appreciate it.
Thank you, Linda. And if I may, just one last point. I just want to say to everyone from a personal perspective and from a business perspective that just be very careful of fear mongering and panic. That can set in really quickly. Please keep rational and keep following evidence-based information to help you to make informed decisions going forward. So thank you very much indeed for that.
Thank you, Lucia. Have a wonderful weekend. Do take care, and
You
thank
too.
you, everybody.